In the world of medicine, perhaps no specialty comes closer to science fiction than interventional radiology. Interventional radiologists sometimes perform procedures that seem downright futuristic. And one such procedure they're performing here at Essentia Health is not only pretty incredible, it's pretty effective in treating a very serious disease. According to the Centers for Disease Control, liver cancer is among the most deadly forms of the disease. Now, interventional radiologists such as Dr. Richard Corsi are suiting up to combat it. They're performing a therapy called Therasphere. Basically, Dr. Corsi injects microscopic radioactive beads into the bloodstream leading to the tumor. Once there, the beads get stuck inside the tumor, cutting off the blood supply which feeds it.
Rather than having multiple radiation therapies where you lay on a table and beams are shot into you, this is actually an internal radiation where you preferentially kill tumors.
Dr. Corsi says patients often experience fewer side effects than with more traditional cancer treatments, such as chemotherapy and radiation.
Because the liver doesn't really respond so great to high-dose radiation that patients would traditionally get with external beam radiation like a radiation oncologist would provide, they do much better with this. It kind of minimizes what people normally think of as some side effects of radiation therapy.
And the results are pretty clear for both patients with liver cancer tumors which start in the liver and for those which start in other parts of the body and spread to the liver. You can clearly see how this patient's liver tumors have shrunk from before treatment on the left to after treatment on the right. He says it's more complicated when patients have underlying liver disease, such as cirrhosis, but Therasphere is a viable alternative.
We find in general that patients who aren't surgical candidates, who are outside of criteria for surgery, who chemotherapy hasn't worked for in the past, or who have failed radiation therapy, a lot of times still qualify for some interventional oncology procedures which would increase quality of life.
The outcome of the procedure is dependent largely upon when the patient gets it done. In the earliest stages, it can actually be curative. Later on, it can be helpful in keeping the disease in check. And with advanced liver disease, it can help with pain management. For this Essentia Health Medical Insight, I'm Tracy Briggs.